Hey everyone, welcome back. Today, we're diving into an important topic in obstetrics, the non-stress test, or NST, a simple, non-invasive way to assess fetal well-being. So, what exactly is the NST, and why do we use it? At its core, the non-stress test monitors the fetal heart rate in response to movements. It helps us evaluate how well the baby's autonomic nervous system is functioning, which gives us insight into overall fetal health. A healthy baby should have heart rate variability, meaning the heart rate should change in response to movement. If it doesn't, that could indicate a potential problem. Now, let's break this down step by step. When do we perform an NST? We typically use the NST in high-risk pregnancies or situations where fetal well-being needs close monitoring. Here are the main reasons a doctor might order an NST. 1. High-risk pregnancies. If the mother has gestational diabetes, preeclampsia, or other hypertensive disorders. If there's intrauterine growth restriction, IUGR, or if the pregnancy has gone beyond 41 weeks. 2. Decreased fetal movements. If a mother notices that the baby isn't kicking as much as usual, an NST can help determine if the baby is still doing well. 3. Maternal medical conditions. Chronic conditions like hypertension, lupus, or kidney disease can impact fetal health, so an NST helps keep an eye on things. 4. Previous pregnancy complications. If the mother has a history of stillbirth, neonatal death, or placental insufficiency, we may use the NST more frequently. 5. Multiple gestations. Especially in complicated twin pregnancies, like twin-to-twin transfusion syndrome, TTTS. 6. Other factors. Things like too much or too little amniotic fluid, polyhydramnios or oligohydramnios, Rh incompatibility, or suspected fetal distress can also call for an NST. How is the NST performed? The test is usually done after 28 weeks of pregnancy because that's when the fetal heart rate pattern starts to mature. Here's how it works. The mother lies in a semi-Fowler's or left lateral position to prevent supine hypotension. We attach two external monitors to her abdomen, one to track the baby's heart rate and the other to detect uterine contractions. Then, we just wait and observe for 20 to 40 minutes to see how the baby's heart responds to movements. Now, let's get to the most important part, how we interpret the results. Interpreting NST results. There are three possible outcomes. 1. Reactive, reassuring, NST. This is what we want to see. We need to see at least 2 accelerations in the heart rate within 20 minutes. Each acceleration should be at least 15 beats per minute above baseline and last for at least 15 seconds. A reactive test means the baby is well oxygenated and the autonomic nervous system is working properly. 2. Non-reactive, non-reassuring, NST. This means there aren't enough accelerations in 40 minutes. It could be due to fetal hypoxia, central nervous system depression, or even just a sleep cycle. In these cases, we may need to do additional tests like a biophysical profile, BPP, or vibroacoustic stimulation, VAS, to wake the baby up and get a better reading. 3. Equivocal or suspicious NST. This is a gray area. Maybe we see some accelerations, but they don't quite meet the criteria. In this case, we might extend the test duration or repeat it after some time. What can affect NST results? Now, here's where it gets interesting. Sometimes, a non-reactive NST isn't a cause for panic. Certain factors can affect the baby's response, making the test look abnormal even when the baby is fine. Some of the most common reasons include fetal sleep cycle. If the baby is just taking a nap, we might not see much movement. Maternal medications. Some drugs, especially CNS depressants and sedatives, can make the baby less responsive. Maternal glucose levels. If the mother has low blood sugar, the baby might be less active than usual. What happens next? So, what do we do based on the NST results? If the NST is reactive, that's great. We continue routine prenatal care and repeat the test only if needed. If it's non-reactive, we need to investigate further. That might mean a biophysical profile, BPP, contraction stress test, CST, or even an urgent delivery if there's clear evidence of fetal distress. For equivocal results, we can extend the testing period or try a vibroacoustic stimulation to wake the baby up and reassess. Final thoughts. The non-stress test is a simple yet powerful tool for checking on fetal well-being. It's quick, painless, and gives us valuable insight into how well a baby is doing. And remember, just because an NST is non-reactive doesn't always mean something is wrong. Context is key, and follow-up tests help us make the best clinical decisions. That's it for today. If you found this helpful, make sure to check out my other videos for more high-yield obstetrics concepts. Thanks for watching.